जिनके हृदय श्री राम बसे, जिनके हृदय श्री राम बसे, उन और को नाम लियो न लियो। जिनके हृदय श्री राम बसे, उन और को नाम लियो न लियो। जिनके हृदय श्री राम। कोई मांगे कंचन सी काया, कोई मांग रहा प्रभु से माया। कोई मांगे कंचन सी काया, कोई मांग रहा प्रभु से माया। कोई पुण्य करे, कोई दान करे, कोई नाम का रोज बखान करे। जिन कन्या धन को दान दियो, जिन कन्या धन को दान दियो, उन और को दान दियो न दियो। जिनके हृदय श्री राम बसे, उन और को नाम लियो न लियो। जिनके हृदय श्री राम। कोई घर में बैठा नमन करे, कोई हरि मंदिर में भजन करे। कोई घर में बैठा नमन करे, कोई हरि मंदिर में भजन करे। कोई गंगा जमुना स्नान करे, कोई काशी जाके ध्यान धरे। जिन मात पिता की सेवा की, जिन मात पिता की सेवा की, उन तीर्थ स्थान कियो न कियो। जिनके हृदय श्री राम बसे, उन और को नाम लियो न लियो। जिनके हृदय श्री राम। जिनके हृदय श्री राम। जिनके हृदय श्री राम।
Namaste, my dear brothers and sisters. The love and blessings of the Mother and Sri Aurobindo to all of you from Sri Aurobindo Ashram Delhi branch. And Namaste, Dr. Bhaswati Bhattacharya. Welcome to today's session. This bhajan, Jinke Hriday Shri Ram Base, Un Aur Ko Naam Liyo Na Liyo, is about the all-encompassing value of just having the divine in your heart. Because the divine is all, and if that is there with you, then what else do you really need? But then having said that, the devotional song goes on to talk about a large number of ways in which people approach the divine and what all they do for the divine. Each has his own path of following the spiritual quest. But then there are two which have been glorified, that if you've done that, then many others are no longer necessary. And one of these is Kanyadan, that is giving away a daughter. And this is a great value in the Indian tradition, because you spend so many years taking care of the daughter. Your life revolves around her. And then you get detached from her and give her away so that she can take care of her family, her new family. So it is one of the sort of exercises in getting detached from possessions, getting detached from attachments, getting detached from relationships. A great exercise, and having done that, that can take you closer to the divine than many other alternative routes. The second thing that has been emphasized is taking care of your parents, as Dr. Bhaswati Bhattacharya has done throughout her life. So that again has been given great importance because once you have your own family, what we normally mean by that husband, wife, and the children, then very often the parents take a back seat. But then if you keep in mind what they did for you and continue taking good care of them, that itself is better than many other alternative ways of trying to approach the divine. So these are the two things that were emphasized in this devotional song. Dr. Bhaswati Bhattacharya is one of those rare individuals who, having got highly qualified after getting even a postgraduate qualification and practiced for a few years in the field of modern scientific medicine, realized its limitations, and she made up for it in a very concerted manner by going all the way to Banaras, coming all the way to Banaras from the United States, and doing there a PhD in Ayurveda. So she's a perfect blend of modern scientific medicine and Ayurveda. And I now hand over to Aditi for a more formal introduction.
Namaste, everyone. I'll just be briefly introducing Dr. Bhaswati Bhattacharya. She's a Harvard-educated, licensed, board-certified physician. She's trained in family medicine and preventive medicine and divides her time between Manhattan, Paris, and Benares. She's also a Fulbright scholar, an awarded educator, best-selling author, and a published scientist trained in pharmacology, neuroscience, public health, community medicine, and Ayurveda. In fact, her love for Ayurveda brought her to complete a mid-career PhD in ancient Indian chemistry, Ayurvedic pharmaceutics, and pharmacology from Banaras Hindu University. And in fact, her PhD was an award-winning PhD thesis on polyherbal formulations for diabetes. There's also a documentary film called Healer's Journey into Ayurveda on the Discovery Channel, which features her work. Her book, Everyday Ayurveda, is also a national best-selling book published by Penguin Random House. Since 2003, she serves as a clinical assistant professor in the Department of Medicine at Weill Cornell Medical College in New York. And her work at the Dincharya Institute brings the wisdom and science of authentic traditional medicine such as Ayurveda back to the hand and hearts of common people. So today we have her to share her wisdom from the field of Ayurveda, and she'll be talking about the concept of health and diseases in Ayurveda. We welcome you once again, and over to you, Dr. Bhaswati.
Thank you, Dr. Aditi, and thank you, Dr. Bijlani. It's nice to see you again after some time. I think the last time I saw you was a few months ago. So now we are moving into in the Northern Hemisphere, we're moving into the fall or the autumn, as it's called. So we're going to talk about health and disease in Ayurveda today. And I encourage you, I see a bunch of you already written good morning in the chat. So I encourage you to ask questions in the chat. And if I notice them, then I will, and they're timely, then I will also incorporate them into the discussion that I'm having. And we'll have some time for questions for those questions which are not directly relevant to the topic I'm talking about. So the first question to put in your mind in the way that we approach Ayurveda is, what is health and disease in Ayurveda and how is it different from modern medicine? So you've been learning about the overview of health science. You've had topics about different parts of the body so far, you know, the immunology, what is it, why is it, where does the body come from, how did it evolve from a one cell item into a multi-cell organism, what is the, what should we call it, the living synergistic 10 times human cells kind of group of things called the microbiome. What is that? And then what are the different organ systems? And this is the way that physiology is organized in modern medicine. Ayurveda and yoga have conceived it differently, not because they didn't have the tools or because they were inferior, which is the way actually many of my Indian colleagues who moved from India to the West, or my colleagues who are allopathic doctors I'm from Kolkata, so, in Kolkata or Delhi or in Benares, who are allopaths, they have a very big tendency to scoff at or denigrate. Oh, the people in Ayurveda didn't know, they didn't have any tools, they're stupid, they didn't know. We in modern medicine know so much. But if you think about it, it's not that they were stupid, it's just that they had a different idea. The concept of health and disease was very different. Now we are starting to evolve toward that way in the mainstream of the world. So, for example, the WHO, World Health Organization, which is supposed to represent health all over the world, but seems to really represent the allopathic world, they used to talk about health as absence of disease. And then somewhere, a few decades into their existence, they said, well, wait, maybe it's more than just an absence of disease. Maybe there's this concept of, health as having social and emotional and mental wellness in addition to absence of disease. So this concept they thought was very, very innovative. But if you go into Ayurveda, Dr. Bijlani talked about the shloka, which is considered, it's from actually Shushruta, but it says that Shushruta is, one of the ancient physicians of India, says that actually the definition of health is a balance within all of your tissues that are on the material world and of your being that's in the immaterial world. So it includes all of the functions of physiology, anatomy, biochemistry, but it also includes psychology and psychiatry and all the mental and emotional things. And also the community, the social things. If everything is not in balance, then your outer world, which is the macrocosm, and your inner world, which is the microcosm, cannot be in harmony in an ecosystem. So if you go into a forest, it's very easy as a biologist to understand ecosystem. Oh, there's the ecosystem of the ant and the anthill, and then there's the anthill in the larger context of the trees around it, and then there's the larger context of the entire forest. That's kind of how our body is. And so Ayurveda and yoga saw it that way. Yoga saw the body as a bunch of channels and a bunch of energy channels. So there were nadis and there were chakras, not were, but are. And there are different ways in which the breath and the movements can change relationships between muscles and bones, and then the functioning of the organs of the body. Yoga doesn't emphasize the integumentary system versus the hepatic system versus the renal system. It doesn't do that. It just kind of sees that there's a trunk, which is called a koshta, which actually, sometimes it refers to the channel, the main channel of the gut from mouth to anus, but it really refers to the trunk. And it refers to the shakha, the arms and legs, the branches. And it sees that there are many tools by which we can affect our health. So yoga is not just for maintaining health. It's also, if you do yoga therapy, it can shift disease. How? Because as you move things through the channels, you'll get rid of blockages and you'll get rid of buildup that's starting to accumulate but hasn't completely blocked the channels. It'll also regulate the flow, not of air or of water, but also of energy through those channels. And yoga has a complex system. I actually tend to go to yoga therapy by competent yoga therapists who know how to use yoga as a medical system. And that, to me, actually has worked in so many different incurable diseases for patients when I refer them to a yoga therapist. For example, muscle tears that are very difficult, that are going to require surgery, where the surgeon says, well, even if you have surgery, we're never going to get you back to 100%. They work with a yoga therapist who understands the physiology of that process, that quote unquote disease process, or that broken muscle, right? That torn muscle. And through yoga therapy, they're able to find complete healing of their muscle. How is that possible? So having worked that way with yoga therapy, I'm so impressed by it as a medical system. Then there's Ayurveda. Ayurveda says, yes, energy is there. Yoga is one of 6 foundational platforms on which Ayurvedic, the comprehensive science, is created, and yoga is just one of them. But there's also logic, which is Nyaya and Mimamsa and Vaisheshika and Vedanta, and I'm missing one, Sankhya, which is the biggest one. It's the way in which we have evolved from the immaterial being, which is, you could say, soul, or the creation, into our bodies. So using those 3 systems, Ayurveda has come up with a system that doesn't ignore organs, but says no organ is on its own. So what's the purpose in calling it hepatic or renal or cardiovascular or pulmonary system? We're going to talk about everything working together in terms of the doshas. And the doshas are functions, they are principles. So if anyone calls them humors, it's a very bad translation. So I'm going to pause for a moment and just say that one of the big, I'll say challenges, but also opportunities for Ayurveda is to understand that the reason we use these terrible words that are horrible mistranslations is because when those translations were being done, first of all, there were a group of people kind of trying to decimate Indian knowledge for the last 300 years. From a place called Europe, and they were really intent on translating everything from the paltry Sanskrit into the superior English, and they were translating what was known in science at the time of the translation. So they thought that Hippocrates had invented medicine, and he used the words humor, so they used the words humor for dosha. Doshas are not humors. They are principles. They are not just energy, they are manifesting in the material world. Just like electricity, explain to me electricity. It's not about the flow of positive charges like we learned in class 5 or class 8 or whatever. It is about the movement of electrons, the concept of electrons, which you and I have probably never seen, but we've seen the effects of it. I've got light on in the room. So I understand it as a principle of movement of electrons. So if you use that idea of electricity toward doshas, instead of calling them humors and you think of them as principles, there are 3 principles. One is movement happening, both in the microcosmic levels and the macrocosmic levels. So macrocosmic is, you see my arm moving, those are my joints moving, you can hear my breath moving, in and then out, in, out continuously since the moment I was born. If you put a stethoscope here, you'll hear my heart beating. That was beating since my fetal life, before I was actually quote unquote born according to modern concepts. But in Ayurveda, I was already born. All of these movements from the microcosmic level, you can't see it, but inside my cells right now, there's a lot of movement going on. So all of that was put into one concept, the principle of Vata. Vata is one of the main principles. It starts everything. If you don't have movement, then you don't have anything. So in the concept of health, it's proper movement at the appropriate time, in the appropriate place, at the appropriate speed, in the appropriate direction. It's pretty easy. And actually, by using the concept of Vata in the right parts of the body, the right places, I can actually diagnose diseases that I can't do with modern medicine. And then by understanding how to lower the Vata and bring that chaotic movement into a flow movement in the right direction, the right pace, suddenly diseases disappear. Suddenly Parkinson's, which is a tremor, right? It's a movement that's abnormal, will suddenly become calm. How did that happen? We lowered the Vata in the body. Someone has insomnia. It's movement of the mind at night so they can't sleep. So how do you get the mind to be more quiet? You don't just sedate them with Valium or a hypnotic. You can bring down their vata. So I just saw a patient yesterday, and everything she has acid reflux, she has insomnia, she has constipation, she's pretty healthy, but these are really disturbing her because of the insomnia, as she calls it, insomnia. She is not able to remember things. She is not able to participate. Someone's talking to her and she feels like her mind is, she's not present. So she came, she's a big executive at a pharmaceutical company, and she doesn't know what's wrong with her. And of course, she's been to the best doctors and they don't know, and they think they're all different problems. For the insomnia, she gets a neurologist, and for the acid reflux, she gets a gastroenterologist, and for the constipation, that's not even considered abnormal in modern medicine, because doctors don't poop every day, so therefore patients shouldn't poop every day. And so I see Aditi laughing. So you know how funny it is for those of us who have grown up in India, where we can't go out until our grandfather has pooped. And then he says, okay, din acha hoga. Okay, so the day is fine because now I've pooped. And now the family can have their breakfast. And now we can all, go out for our outing. And so in India, pooping is just part of the daily necessary life. It's vata. So this patient didn't understand that all of these are connected. And she also is part of a European lifestyle. So, pooping is not really an important thing for her. So when I explained to her about vata, the prescription was to have 1 night a week without electricity, to spend time considering what your foods are and the principles of vata, and why those principles, and adding those, what we call gunas, those qualities of vata into her life, are increasing her vata. So she travels frequently on airplanes. I said, we can't stop the travel, but put sesame oil, til, under your feet. So, take a little oil and then rub it under the soles of your feet before you fly and before you go to bed every night. Why? So since I find that case-based learning is very important, I'm just going to explain this. I'm not even going to open my slides yet. I'm just going to explain this because I think this is important for most of us. Cold, dry, light, mobile, and rough. If you can write those 5 down, it's a very, very great guidance. And this is actually going to help you with 1/3 of all medical conditions. Cold, dry, light, mobile, rough. There's your acronym on the chat. And if you write that down, write them vertically, and at the top write vata. And cold, dry, light, mobile, rough are the qualities of air and ether, wind flowing through, right? So in the autumn, what you'll notice is you'll go from hot weather to cold weather. And as the hot temperature cools down, there's more wind, so you have more mobility, more lightness. Things that are like, let's say, a towel that's drying will become more dry because of that wind blowing through it, and it will become more rough. Just as your skin will, you'll notice that your skin is out in the cold, maybe not quite yet in September where you are, but by the time you get to November, it will be. And that coldness will also induce a certain rigidity and roughness. Ayurveda says that is vata taking over in the body. And that's typical of this change of weather, which happens because the earth is tilted and we're moving around the sun. And as we do, the sun had more emphasis in the northern hemisphere because it was closer. And then as we rotate this way, there's more on the southern hemisphere, and more light falling on the southern hemisphere. And so as it rotates, the southern hemisphere gets more light and the northern hemisphere gets less light. And so the weather gets colder, and then the whole cascade of what I said. So if everything is getting cold, dry, light, mobile, rough, and you eat foods that are cold, dry, light, mobile, rough, and you have routines that are cold, dry, light, mobile, rough, and you end up taking medicines which make you colder and lighter and drier and mobile, more mobile and rough, then you're going to have more vata in your body, and your physiology of all your tissues are going to experience that cold, dry, light, mobile, rough. So there are 4 concepts of physiology. One is going to be the doshas that are going to be affected by cold, dry, light, mobile, rough. One is going to be the physical tissues, which we call dhatus. Dhatu kind of means a grounding or foundation. Dhatu is the word for not just the solid base, but it's also another term in Indian languages for metals, because these are things that are grounding and they're not moving around and getting destroyed. Like a leaf gets destroyed, a cube of copper doesn't get destroyed. So that's called a dhatu. So there's doshas and dhatus, and then there's agni, which, this is again one of those English translations. We translate in English as fire, but agni does not mean fire. Any of you who have studied Sanskrit know that agni means that which consumes. So fire is a type of agni, but agni is not a type. Agni is not a type of fire, because there are many things that consume. Love consumes, right? Anger can consume, but they are not fire the way that we think of fire. So in our body, we have that principle of consumption. There's not a little campfire, going on inside your stomach or your small intestine, but there is agni. And agni is that which consumes. It's that which transforms. So there's dosha, dhatu, agni, and there's shrotas. Shrotas is channels. So when we talk about channels, there are, the anatomist, surgeon, Shruta talked about 15 different channels, right? So Charaka, these are the 3 kind of great texts. They all talk about these channels, the shrotas. And disease happens when the channels are not flowing properly. That's basically the definition of pathology. So if you come to the vata example, what happens to a channel when wind flows too quickly through it? It becomes dry, it becomes brittle, it'll become cold because the movement induces a contraction, which is cold. It will definitely become rough and more light because the heaviness of the water disappears. The water and the humidity is a key factor in this whole discussion. So for vata, what is the solution? So let's take it from that principle of vata through the gunas, cold, dry, light, mobile, rough, into the practical. So for this patient who's got all this movement going on, I said, what's the opposite of cold? She said, warm and hot. Okay, what's the opposite of, so I'm following the CDLMR, right? What's the opposite of dry? Many people say wet, but it's actually not wet, it's moist, right? Unctuous, moist. What's the opposite of light? Heavy or grounded. What's the opposite of mobile? Stable or grounded again. What's the opposite of rough? Don't say unrough. What is it? It's soft, right? Now, the word ruksha is dry and rough. So sometimes we say the opposite of ruksha is going to be snigdha, which is the Sanskrit term for unctuous or moist or soft, right? Sneha. So we think of oil. So now that we have that in place, think about the foods. We're going to do 3 parts. This is another pillar of Ayurveda for health. There are 3 parts. So there's ahara, which is that which you take in. Hara is to lose. So ahara is that which you don't lose, so that which you take in. Second is vihara, which is lifestyle or the way in which you conduct yourself. And the third is oshadham, which is all the things that we call medicaments, right? So that can be physical and chemical, or it can be energetic and more emotional, mental, non-material. There are also 3 other principles. That's another kind of tripod of stability. And that also includes food, called ahara. It includes sleep, which is nidra. and it includes brahmacharya, which is always misinterpreted again in this wonderful English. They say celibacy, but brahmacharya does not mean celibacy. It means the acharya, the movement of your feet, right? Chalana is to move. So acharya toward Brahma, which is the uniter. So in order to be united, you need to be at one with the world. And if you're in the material world, sometimes that means relationship. So I say that brahmacharya is the ability to conduct intimate relationships with your family, your friends, your loved ones. So that doesn't just mean sex with your spouse, which is what people think is, this concept of celibacy, but it means having intimate relationships that are so intimate that you're at one with the world, so that you are not seeing them as other and you as something that you have to separate from them. They are part of you. And this is a kind of hard thing because a lot of people are challenges, right? It's one of the way we have challenges in our life, but that's there. So these are two different tripods. Don't get them mixed up. But if you look at them, you'll notice that ahara is in both of them. Okay. Come back to our vata example. What can we do that's ahara for foods, for bringing in those gunas, which were not the vata gunas, but the other? So someone say, well, I just love to eat trail mix when I go. Trail mix is dry nuts and fruits. Is that cold? Yes. Cold or not warm. Is it rough? Yes. Is it light? Yes. So do the opposite. So warm up the nuts that you're going to eat. If you're going to have almonds and cashews or walnuts because you learned that they're healthy, warm them, moisten them, put them in some warm ghee and saute them, or put them in some hot water, soak them. That you can do at the office. Just have some hot water in a bowl, soak your nuts, and then eat them, right? Or instead of having dry fruits, have an actual piece of fruit that's moist and that's got its own water, its own juice. Soups are the go-to. So soup can mean some liquidy dal. It can mean a vegetable soup. So that is a very nice warming, grounding, heavy, right? Not dry, but usually moist and stable. So it has all 5 of those gunas, qualities. So I go through the foods one by one and I talk about the grains and the vegetables. Instead of using a light salad with lettuce or light cabbage and raw cold things, have something more grounding. Saute spinach rather than having a spinach salad that's light. Instead of having raw tomatoes, have grounded tomatoes that have been sauteed in some oil or some ghee, or at least cooked in some water if you can. So choose those options of foods that are going to be more grounding. So instead of ice cream, which is cold, have some warm apples that have been cooked in some cinnamon and some water into an applesauce. Right? Instead of having cold rasagola, of course I have to say rasagola because it's Durga Puja time and I'm Bengali. So instead of having cold rasagola, have that rasmalai, which has got the malai, the milk in it. It's warm, it's served warm, right? And put some warm sauteed nuts on it, like some sliced almonds or cashews. So choose the one that's heavier. You may say, oh, but I'm getting fat. The solutions are many to weight loss, but here we're not talking about getting fat or thin. We're talking about lowering your vata. And when your channels are flowing and your digestion is better, you will naturally lose weight. It's a process and each person is different. So there's not one prescription for losing weight. But here we're not talking about weight gain or weight loss. We're talking about full groundedness so the digestion is good so that you will not have this imbalance that creates weight gain. So that's ahara. Lifestyle wise, I talked about the sesame oil under the feet, but there's also the issue of going to bed on time. So the way to get up early is not to get up early, it's to go to bed a little bit earlier, right? So I'm having her do an electricity fast on Thursday night this week. So by Friday, I'll know what's happening. And I've done this 100 times and I'll tell you what's going to happen. She's going to go to bed earlier because she doesn't have the electricity on. We each have a time somewhere between 8:45 and 9:30 that we have a little lull where we really feel like we want to fall asleep, and we don't do it. we've pushed through it. We have to cook dinner, we have to put our kids to bed, the TV is on, mother and father haven't had whatever done, they need their medicines, they need this, still out at work, business dinner, at the friend's house, and that desire to sleep happens, and we push past it and we stay awake, and then we can't sleep. So when you do an electricity fast, I hope you all understand what an electricity fast is, right? It's at the end of the day, when the natural light goes out because the sun sets, you don't turn on any lights. Some of you live in places where you have a ton of street lights and patio lights and all, but if you don't turn on any lights in your house at all, and the whole family agrees to it, no opening of refrigerators, no using your cell phone, no using your iPad or your computer screen like we have right now, no lights above. You have one candle that you can turn on to take to the bathroom. What happens is that your vata comes down. On a chemical level, what happens? Let's talk modern chemicals for a moment. When your eyes get light in the night, they don't make melatonin. You have genes in your body that are detecting light. When I say genes, I mean there are genes are in DNA, DNA is in cells. Those cells that are in your light capturing parts of your body are not just in your eyes. You think you see light through your eyes, you also see it through your skin, through organs in your neck, and they go and feed information to your pineal gland, which makes melatonin. And that then talks to your hypothalamus and your pituitary, which then the next morning send out a bunch of hormones and chemicals, one of which is to your thyroid glands, then to your adrenals, your cortisol, your testosterone, is estrogen, and your entire body of hormones that we see on the modern medical side correlate to Vata, Pitta, Kapha on your Ayurveda side. And so if you have improper alignment with the nature of the sun and the moon, you're going to have malalignment of these chemicals in your body, but you're also going to find that you're not going to fall asleep properly because you're not aligned. And so that is going to lead you out of the alignment and into that place where you have insomnia and where you can't go to sleep at night. So if you can do an electricity fast once a week and see what happens, you'll go to bed earlier. Many yogis already do this. Many people in Ayurveda who are like hardcore Ayurveda people already do this. And yet they live in a modern world by, like, for example, I had all of my fluorescent lights removed. I kept one in one of my rooms in Benares so that I can, in case I need really bright light. But I had all of them removed and I put in orange lights because during the day, I don't really need to turn on the light. I have enough light in my house. And at night, I want it to be a little bit dimmer. And so the orange lights are a little bit dimmer. You only use like 7 watt or 11 watt bulbs. And so I have a nice ambiance, but it's not bright. And that way, naturally 8, 9 p.m., I don't feel like being super awake. I've got my lights down. Yes, I sometimes have work, doctors get phone calls and we have all kinds of stuff going on. I do have my computer, but more and more, I don't use my computer after about 8 p.m. I have kind of a little limit for myself. I've set the timer so that the computer turns color, it turns orange, and I know that it's, a no time. So by doing all these things, the vata is coming down, right? So lifestyle, choosing things that are going to make you move toward the natural alignment. This is going to reduce your vata. Why vata? If you're confused about this, think about vata as a principle of movement, and the movement of chemicals through your channels or the movement of light through your body is all encompassed in vata, all right? Oshadam, I'm just going to give you some of the medicine. So I already talked about sesame oil. So Sri Vidya is saying black til oil, no. I'm talking about white sesame seeds and their oil, which is called til tel. So til tel is not the Japanese roasted oil. It is it's the kind of golden colored, unrefined sesame oil that you can buy in stores. Now, what I find interesting is you can get it in New York, where I live. You can get it here in Paris, where I live. And you can get it in Benares, where I live. But when I go to Kolkata, Delhi, Bombay, it's really hard to find til. And I wonder why. I mean, you can get it like in an organic store, but not at regular grocery stores. So yeah, Srivida, I just said it's from white sesame seeds. So if you're listening, then it's white sesame seeds. So if you can get that sesame oil and keep it in your house, it's one of the main oils to use for a variety of things that will help you with vata. So in the physiology of the body, we have to match it with medicines, right? So there are medicines that have been classified by the great Ayurvedic scholars, and they have said that there are properties in all these different substances. So let's say there's about 10,000 or so that were commonly seen on the Indian subcontinent, not in every part, but overall. And doctors would come together in conference and discuss these many times. And these are cataloged in the Charaka Samhita that, you know, doctors got together and they decided to discuss what was working. Of those, there's about 7,000 plants that they found that were unique and interesting and had potential real medical uses. And of those, only about 450 made it into the books of these are reliable, used by humans, and we can consistently use them. So that was the kind of evidence-based logic that they use. And their evidence was not double-blind, randomized clinical trials. It was over time seeing what worked in clinical practice. So I tried this on this patient and it worked. I tried on a second patient, it worked. I tried on a third patient, it worked. Versus you tried it, it didn't work. You tried it, it worked. You tried it, it didn't work. It's inconsistent. We're not going to use it. So if you take the ones that we did use, they included sesame oil. And the logic that was found by doing little experiments, watching animals, watching it in nature, was that sesame oil actually burrows into those srotas. Remember, srotas are those channels. And it cleans out the muck. So if you have a channel, let's say in your mouth, you have a bunch of nerves, your trigeminal nerve, your facial nerve, you have a bunch of nerves. But around your mouth, you have all of these muscles. See how I go, So there are all these muscles. And the nerves sit between muscles, vessels, and they just kind of sit in the tissue. And when I go like this and move to my space between my muscles where the nerves are opens up just slightly. If I keep sesame oil in my mouth in a process called gandusha, and I keep the oil in, the oil will climb into that space. And if there's any muck in there, any kind of residue or toxin or undigested particles, it's going to get that out of there and it's going to clean it out. That's the technical description. What's the practical part? People with vata diseases, like a neurological disease called Bell's palsy, where the face droops like this on one side. Bell's palsy is the disease name, but it's basically where the nerve has stopped functioning. Sometimes they don't actually know in modern medicine what the cause is, but we say it's due to vata. The channel is not flowing the information from the nerves properly. You have the person put sesame oil in their mouth. This side is paralyzed, so they can't go, So it looks like, And they get the oil in there and I tell them, swish it around, and they swish it. And after about 10 days, they say, I could see a partial. This side, I'm still fine. This side is partial. And over time, the drooping resolves because the sesame oil goes in and pulls out the scar tissue or the residue, and the nerve can regenerate. And I've seen this again and again and again, both with recent cases of Bell's palsy and old cases. These are vata cases. These are cases of movement not happening. Any paralysis or nerve problem is a movement problem in general. And so the sesame oil is very, very, very good for that. So that's one substance that's very useful. There are also herbs, because everyone thinks, Ayurveda means herbs. Look, these herbs are not Ayurvedic. They are cataloged in Ayurveda. But if you don't know how to use them according to dosha, dhatu, srotas, and agni, and you say, well, I put turmeric, I sprinkle turmeric on my food like salt and pepper. That's not Ayurveda, because you don't even understand how to use it according to the principles, the way, the philosophy of Ayurveda. But there are these herbs, and all of these herbs are classified as things that increase the warmth, go to the gunas. So they decrease the cold, so they increase the warmth. They decrease their dry and rough, so they increase the moistness and the unctuousness. They decrease the lightness, so they increase the heaviness. They decrease the mobility, so they increase the stability, right? So they include things like dashamul, which is a combination of dasha, 10, mul, roots. Dashamul can be bought together. It's 5 trees roots and 5 little plants roots. So dashamul, it includes brahmi, which most of you have heard of, which lowers the vata. It includes a whole bunch of things that warm, that are spices. So spices that warm up the body. Think about ajwain, right? Ajwain is called joan in Bengali, but the Sanskrit word is ajwain. Is there another word for ajwain that anyone can offer that is more common in another language in India? I think ajwain is the main one. There are many, many heating herbs, right? So turmeric is slightly heating. It's cleansing. It's an anti-inflammatory. So these spices are there. There's also herbs that are heating, but have other properties that make them not net good for vata, but they can be used for vata diseases. So punarnava is great for lowering vata. Punarnava is excellent for the kidney and bladder system. I oftentimes use it for people that have nervous bladders or interstitial cystitis, which is not really a vata condition, but it involves vata. And there's a whole bunch of nerve tonics that are great for vata diseases. So these include the osham. So I've gone through some of the ahara, the vihara, and the oshadam in these last, half hour or so. So that's vata. So we also have pitta and we have kapha. And we could go through those as well. We could spend, a few hours going through the pitta, which is the theme of transformation and transmutation. So that includes things, if you put potato in water, it'll transform it, right? Either the little eyes will come out and sprout, or if you heat up the water, it will cook it and make a raw potato and a baked potato. Fire will also do that. It will cook the potato and either burn it completely or it will make a baked potato. So the potato changes with water and fire, and that's a way we can see it. In our body on a micro level, it's the hormones, the enzymes, the things that change body function from one to another that help us digest or that move things from one form into another form in our body. It can be thoughts, right? When you move the thoughts from your mind, which is your heart and your brain, and you say, I think I want to become an engineer, and you go through that idea and then you do the work and you transform that and then you apply to engineering college and you get in. What moved you from not being an engineer to being an engineer? That's called sadhaka pitta. It's a will force or the transformation of your ideas into action. Pitta is also in your stomach and small intestine. They had the idea of the organs, but they considered them in a physiologic way rather than an anatomical way. So they said the digestion happens not in the stomach, but in the lower stomach. The upper stomach is more for storage and for an antacid that's produced, which when Ayurveda was talking about it, people thought they were just wrong and primitive, but now modern medicine has realized that there is an antacid that's actually secreted right where the esophagus becomes the upper part of the stomach. It's called the cardia of the stomach. You guys will learn about that in the gut section. And then in the lower part of the stomach, there's a cauldron, which is made to hold a lot of acid and do a lot of digestion. So that digestion, that heat and that that very low pH, which this acid will create digestion, continues into the upper part of the small intestines, which is physiologically considered to be or anatomically considered to be a separate organ, but physiologically a continuation of digestion. So Ayurveda says cut that part together, the lower stomach to the upper small intestine, and that's one area. And that's called the Pitta Shaya. Why? Because that's where the Pitta, the transformation happens, right? So Pitta happens in different parts of the body as well. And then Kapha is a theme of stability and lubrication. And we know that stability is what allows our body to be here. So all of the things that allow our body to be grounded and stable and allow us to have the lubrication that's needed so we don't chafe our physical organs and lose them because they kind of grind against each other and then become diseased or malformed. We want to make sure that that's smooth. Okay, so I'm conscious of the time and I'm just trying to, I'm sitting in Paris where it's like, what time? It's 5:51. My clock is my New York clock and you guys are sitting in India. So Aditi or Ramesh, please tell me how much time I have remaining. Is it 9 minutes?
No, we can go up to 9:40, which is 20 minutes till you can speak, and then we can open for the question answer.
So 20 more minutes. Okay. So hi, Pablo in Mexico. Nice to see you. And hi, Sangeeta in Canada. Wonderful. I'm glad that you guys are all over the world as well. I'm going to start some slides of some things I wanted to share with you about health and disease. So I hope this part about Vata is interesting because we are moving into the fall and it's very, appropriate for this time. And during the question and answer, I'll talk a little bit more about the circadian rhythm and answer Sangeeta's question then. But just for the sake of time, I'm going to move into my slides now. So this is a little presentation that, I'm not going to do full screen because I feel like I need to see all of you guys as well. But I think you can see the main part of the screen, yeah? So I began today with obeisance to my gurus. So we just finished Pitra Paksh last week and now we're in the Durga Puja time. But I just give obeisance and regards and gratitude to all of my teachers. All of my teachers on the left side are in America and my original and first trainings, first PhD in pharmacology, neuroscience, and my bachelor's degree in neuroscience and all of the other work I did in the medical world. And then at the top, of course, is my mom and dad. And then along the right side of the screen, you see all of my work in Ayurveda and yoga and really moving into Ayurveda, which I've just fallen in love with. So I give gratitude to all these teachers. Dr. Chai has been my mentor at VHU, and I can't say enough great stuff about him. So let me just show you a few slides here. Physiology to me is one of the most interesting areas because it's evolved. Number one, in Ayurveda, we see that there's a lot of mistranslation that moves it from coming forward. I talked about the word Agni, I talked about the word humors, but there's a whole bunch of examples. And one is the fact that there's a lot of talk about how Ayurveda is backwards because a lot of the things that are prescribed just aren't relevant to the modern day. So one of them is that in India, I think most people here, not everyone, but many people here are Indians, we talk about how hair oil and putting hair oil in our hair is so important. So as a little girl, so I've been back and forth between India and the US my whole life. But when I came to America and I would have oil in my hair, jaba kushum tel, right? I put it in my hair. My mom would put it in my hair. Americans would say, you're so dirty, you're so smelly. Why do you put oil in your hair? And I'd say, oh, it's good for the brain. It helps the brain grow. That's what my mom taught me. That's disgusting. Don't you know that there's no connection between your hair and your brain and the inside of your brain? That's ridiculous. That's backwards. So I went to medical school and someone was saying to me, yeah, Indians, like ancient India, why do you hang on to that stuff? Because it's all irrelevant now. So I learned from my modern training that there's no connection between the scalp arteries and the carotid artery that feeds up, your vertebral artery that feeds up into your inside of your skull, so in your brain and your what you can say, your nervous tissue, right? It's totally unrelated. So what we find out is that there are these capillaries. So a lot of this work is actually, this is one of the pieces, but another is by this guy named Johnny Kipnis that's doing immunology work with the cells that are the cushion cells of the brain, which are called the glia cells. And it's amazing work that they're doing, anatomy work. So in this study that I've put, this is a radiologic study, and it shows that there are these veins that go from the scalp through the hair follicles down into the circulation that's in the layer just under the scalp, into the covering of the brain, through the skull, which is the bone, into the covering on top of the brain, which are called the meninges, and then into the actual brain matter itself. And you can see that it goes all the way in here, but it also makes its way into the sinuses, which is the collections of fluid. And there's another study that shows that it actually goes in, they have a lateral, you can say your cerebrospinal fluid, which is your liquid that kind of bathes the brain and the spinal cord, and it gets into that. So the emissary veins actually go into the intracranial, inside the brain sinuses. And this shows that actually there is connection between these. So the practical is that you put this oil on your scalp during Shirodhara, or the hair oil that we put on our head. And that hair oil is not just a cosmetic thing, but if you have herbs like Shankapushpi, which increases memory, Jatamamsi, which gets rid of nightmares and various mental hallucinations or aberrations of the mental and emotional self, Brahmi, which is calming, Ashwagandha, which is both calming, brings down vata, but also energizing. Put these into the hair oil and then massage that oil. It really does affect health. And a lot of Indian moms, especially, well, now grandmoms, say you have to put this oil on your kids' head to keep them healthy. Here's another one talking about ojas. Ojas is the idea of the immune system. So if you have great ojas, you have this vitality and this charisma and this glow about you, that is good health. Why? Because it's a summation of everything going right, so that you can exude this light around you. And you'll see that around people who do yoga and Ayurveda on a regular basis. And yes, they have electromagnetic waves around them and Wi-Fi, and yes, they get a lot of sun, and yes, they sun meaning like vitamin D, but also sun meaning like melanoma and all that. All of the risk factors that modern medicine talk about, they get those, but somehow they filter through and they still put everything together, so they get really good strength in their body that comes out as this glow, this vitality, and that's called ojas. So the decline of ojas means that your immune system that protects you and your ability to transform your food and everything you take in has to be fully digested and then implemented into your tissues. If that's happening, great. If it doesn't happen, then your immune system is weak and you will get everything that I talked about with the vata, right? Breaking down because your movements are not well conducted on a micro level. So here it talks about how lack of fortification with food, mental worry, not being happy will bring you this decline from ojas, which is you'll get pain, you'll get loss of your complexion, you get loss of cheer. And we see this today with depression, and we see how impotent most of modern medicine is in dealing with depression. They're kind of normalizing, oh, people are supposed to be depressed and out of it and mentally, ADHD is now neurodiversity. It's not vata imbalance. And so all of this comes from understanding ojas. So this is kind of the understanding of the immune system using all these cells, which is a very complicated model, and you can go into all of the different chemicals and tumor necrosis factor and leukotrienes and these molecules that are creating problems with your immune cells. Or you can understand the idea of ojas and resilience. It's not as micro level precise, but it is on a practical level much more implementable. We talked about ahara and vihara. So I actually started writing these columns in response to COVID back in 2020. And I just have continued them with this New York-based newspaper called the South Asian Times. So if you go to my blog, which is called everydayayurveda.substack.com, I think I have it somewhere here, you can find all of these and you can sign up and get these weekly. And I just talk about Ayurveda, different concepts of it. So these are just some of them. This is about Juta, which they spelled wrong here, but they all talk about ways in which Ayurveda can affect you on a practical level. I talked about ojas already, and I'll skip over this. Here's a concept which is not understood by many people, and that is Satmya and Okasatmya. So health is you being in balance. How? If two twins are born in Bangalore and one is brought up in Japan and another one is brought up in Paris, they're going to have different food and different lifestyle around them, right? One is going to learn to eat fish and soybean seeds called edamame and rice, that's sticky rice, and seaweed. And another is going to learn to eat, I don't know, pork and beef and wine and cheese and the kinds of things people eat in Paris. And they're going to have completely different gut microbiomes. They're going to have the same genetics. Let's say they're twins, so they have the same genetic DNA, but their epigenetics, the way in which their DNA expresses itself, is different, because Ayurveda says what you do in your early life, so it's from the time you start eating solid food, which is supposed to be 6 months into your, after your birth, into about the time that you start losing your teeth, which is like 6 years. So 6 months to 6 years old is the time that your body creates the factory by which you will decide what you can eat and what you can digest. So that is also a food experience. If your mom says, yummy carrots, here, try this, and you see a happy face of someone you love, you as a 1-year-old or 2-year-old are going to eat those carrots, pureed, mashed up, but you're going to eat them and you're going to love them. If your mom says, ew, I hate carrots, but honey, they're good for you, here, have some, you're going to get that energy and emotion of carrots are bad for me. And your okasatmya is going to be, I don't like carrots. Okay, so if you're in Japan, I love fish, I love rice, I love seaweed. And if you're in Paris, you're like, oh, I love cheese, I love fresh vegetables, I love these meats and these eggs and these things. They're very different okasatmya. Now those two twins come back to Bangalore where everyone's eating idli and dosa, and maybe they'll eat a little bit of it because it's in their genetic background, but they're not going to be as comfortable eating it. And this is what happens to people who are transplanted all over the world. They don't have that same satmya. So when you build a prescription for someone, it's, I just did an interview where someone said, what's the right food to eat? I said, it depends. It depends where you're brought up. It depends what you're used to eating. It depends on your genetic background 3 generations before. And it depends on what your own parents or guardians gave you. So this idea of your immune system, your microbiome responding to what you were exposed to as epigenetics means not your DNA, but how your DNA are influenced by the environment in which they are kind of imbibing, the environment. So what you're eating and what you're drinking, all of that is going to affect what you consider your optimal food. So that's why prescriptions have to be individualized. So if I make a prescription for Dr. Bhomik, who's used to eating hospital food and on the run and eats a lot of processed foods, I'm going to create a very different prescription than I would for Dr. Bijlani, who used to work in a hospital, but now eats very sattvic, live, handmade, non-processed food, right? It's got to be different based on their way that they are existing. And Ayurveda does that because it knows something called Dashavida Pariksha. So I just did a series of videos on those. You can find them on YouTube. Just put in Bhaswati and Ayurveda and they should come up. And they talk about the 10 factors that you have to go through for every patient in order to individualize a perfect prescription to take them from disease back to health. This is something you don't have in modern medicine. Modern medicine says, this is the disease, you have hypertension, here's the medicine and take it for the rest of your life. This is thyroid, hypothyroid, here's your levothyroxine, take it for the rest of your life. It doesn't say, I gave you the levothyroxine, let's see how your body adjusted to it. And now let's maybe see how we can bring you back into balance. It just assumes that if you have this disease, it's permanent and it's static forever, right? So, okay, maybe you adjust the dose a little bit based on how much exercise you're getting. But basically, if you have hypothyroid, there's no way you can work with it. But practice-based evidence shows that there are thousands of people who are changing their dinacharya, their circadian rhythm changes. It realigns, and all of a sudden, that pineal to hypothalamus to pituitary to the thyroid stimulating hormone that makes thyroid changes, and suddenly they don't have this hypothyroid anymore. Condition doesn't require levothyroxine. This is all satmya and okasatmya. It's the way, okasatmya is how you are brought up. Satmya is what you're used to in your daily life today. Then there's the best. The best in Sanskrit is called agriya, the best foods. And one of the bestest foods for humans is ghee made from cow milk. I know people have a lot of issues with cows, and that is because man has abused cows for the last 100 years. You know, I know we celebrate Khurana for his work at Amul, but what he did is he basically used thousands of cows to pool the milk and give it to people, and it's pasteurized and homogenized and chemically processed to put in plastic bags. That is not how to have milk. And so when people say, well, I'm allergic to milk and I don't eat dairy foods, and cow is for baby, milk is for baby cows, not for baby humans. And I hear all that. I watch them and I say, go to Switzerland and have actual milk from the farm, or here in France. So I go out to the countryside and I get the milk, and then I drink that, versus the pasteurized stuff that we have. In Benares, one of the reasons I live in Benares and not in Delhi or Bombay is because I wanted to have fresh cow milk. That was actually one of my criteria. Fresh ghee, properly made dairy products. And it changed my immune system and I healed. I was actually very sick. I was becoming very sick from my work as a doctor, you know, burning the candle at both ends. And I noticed that my body was in decline. And the doctors, when I would get my annual physical, they said, oh, it's just age. I said, are you kidding me? No, it's just age. This happens to everyone. You know, you'll have a heart attack, you get everyone gets something. You just have to, you know, it depends which cocktail of drugs you're on. And I moved to Benares and I spent time drinking cow milk every night and every morning. And I will tell you, I lost 25 kilos. So that was the first big thing. In addition to that, my entire microbiome changed, my skin changed, and my hair came back. And you know, I was kind of subclinically, like kind of hypothyroid a little bit. It all went away. So I really believe in the power of true cow milk, not milk that we buy in the, you know, packets or the containers. And from it, properly made yogurt, and from that ghee. So if you don't make yogurt to make the ghee, that's not ghee. That is improperly made ghee. So milk to yogurt, yogurt to churning it, butter, butter to ghee. This is one of the best foods you can give to your body. And it has been analyzed in terms of the linoleic acids and the small chain fatty acids and all of the chemistry. But the fact is that Ayurveda says it is closest to your dhatus. So if you think biochemically about the cell walls and what they're made of, ghee is closest to the biochemistry of your bodies, the human body's cell membranes. And that is very important for us to have a source that we can actually work with. So I'm going to end with a couple of slides. One is on the different, we can call them modalities. So up here are the things which we know in modern medicine: fasting, which is called upavasa, diet, lifestyle, exercise. Then there's the stuff that we kind of assign to complementary and alternative medicines, which is meditation, yoga, pranayama, maybe some sound therapy, or the use of foods, or some massage or aroma. It's all kind of like all that alternative stuff that's not real clinical medicine or chemical medicine. And then there are a couple of sections which are really related to Ayurveda. Ayurveda talks about rasayanas and the rejuvenative medicines. It talks about using marma points, which are the predecessors of acupuncture points. It talks about using herbs and the living energy of herbs in various formulations, the kalpanas. Kalpana means formulations, which take that living energy and the gunas of those plants and bring them into the human system. It also talks about an intense cleaning, we can say, algorithm, which is called panchakarma. And panchakarma has 5 pancha ways, karmas, in which they use oil to clean out the body. Why? Because our cell membranes are lipid bilayers, they're oils, and most of the dirt gets trapped in oils and in fat stores. So if you can clean out that oil, then, imagine if you have a dirty pot of oil, how do you clean it, right? You sift it, you filter it. Think about how you do it. Some people just throw it away. Well, you can't throw your body away, but you can clean out your body. And the way to clean out the oils of your body, the lipophilic areas, is through the panchakarma. And then this bottom part is the subtle energies. And as much as people will poo-poo and say there's no role for subtle energies, that's all ungrounded, unfounded, it's all hocus pocus, there's so much basis in physics about the subtle energies, whether you're talking about entanglement theory or some of the ideas behind dark matter. There is energy. Our bodies are energy. If you ever see someone in the ICU who has all those wires on them, when they do CPR, defibrillate them, they'll say, stand back. Why? Because your biological system, if you're touching that person, will conduct electricity. That means you have electricity in you. That's why an EKG or an ECG shows the electricity flowing from the place where the lead is and your heart, because there's an electricity flow. If we know that there's a biologically produced electricity in your nerves, in your heart, then why don't we use that energy, or at least acknowledge that energy can affect the health and the disease of our system? Ayurveda does. And so it says the use of subtle energies is very important. Okay. So here's the last slide I want to end with. Ayurveda understands the body from the 10 to the minus 24. So 10 to the 23 is Avogadro's number, right? So 10 to the minus 24 is beyond the number of particles. It's subtle energy. It's waves, not particles, right? Ayurveda understands it from 10 to the minus 24, which is a yoctometer or a yoctogram, to 10 to the plus 24, which is a yottameter. It's beyond the size of a planet. It's the size of a galaxy. So in Ayurveda, we talk about yatha pinde tatha brahmande, from the smallest microcosm to the largest macrocosm, this entire axiom of principle of how particles and energies work. Ayurveda does that. What modern medicine does is it works from nanoparticles, which is 10 to the minus 9, up to maybe like, I don't know, hectoparticles, so 10 to the 2, right? That's all the range. And if you look at this, you see that, you have these little particles, gaseous contaminants, up to like the larger proteins and particles. They don't really go to the large scale of perception. So they can't acknowledge the presence of these factors because modern medicine just doesn't see things on that level, right? It hasn't got that perceptive ability. So if you realize that Ayurveda really does see things in a larger framework of reference, a scale of perception, then you'll see that that's why Ayurveda can see health and disease on very subtle energy levels, as well as having cosmic effects, like when we use Jyotish and say there's the influence of Mars or Jupiter that's working on your body. So, I can obviously go on for a long time, but I'm going to stop and encourage you to ask some questions, and maybe I'll show you a few other of my slides based on those questions. Thank you, Dr. Bijlani, for involving me in your classes. And I hope that for all of you here today, that this has been fun and useful for you. Dr. Bijlani, did you want me to answer some questions, or Aditi, do you want to guide
Yes,
this?
there's just one question in the chat box if you can answer.
Okay, I see two questions. So the first one is from Sangeeta. What's a practical way to align our circadian rhythm when the sun sets at 5 p.m. and sunrise at 7 a.m.? So you just get your body ready. So you have your dinner right before sunset when it sets that early. So 5 p.m. means you should have your dinner by 4:30, 4:45. And you should settle into longer hours of sleep so that you wake up around 6:30, 6:45. Before that, actually, they say 45 minutes before. So let's say 6:15, you wake up and you slowly do your breath work, your pranayam. Maybe you go and have some hot water. Maybe you sit and you have a little cuddle with your kids or your partner. And then you get up and you start your day. Farmers would do that. I know today you think that you have to work a 9-to-5 job, and so you don't even get home from work till 5 o'clock. But once you get home, wind down quickly. And if you do that, you'll find that you are much more in tune with the winter months, and you won't need to have as much activity, but you can, on weekends or on days off, you can have, actually, we have a lot of holidays in the winter months. So you can align. If you have any specific questions, Sangeeta, you can post those. But I do find that it's very easy to align with circadian rhythms in these cold months as well. Second question I think Aditi was referring to was from Promita, which says, are certain conditions like slip disc or arthritis or severe hair fall leading to baldness cause of dosha imbalance? They are actually not cause of dosha imbalance. They are caused by dosha imbalance. So absolutely, hair fall is due to bone problems. The hair is related to bone in Ayurveda. So when you have hair fall, it means that your hormones and your body nourishment means not just what you eat, but what you digest and what you take in from your main channel of your gut across the blood barrier. And then not just the blood, which modern medicine looks at, it talks about bioavailability and blood levels. Ayurveda says it doesn't matter what's in your blood level, it matters what gets into your cells. So if it doesn't get into your bone and your cells, it's not going to create good, strong bone, and you're not going to get strong nails and strong hair. So obviously it's about your nourishment. It's about your vitamin D also, but it's also about your exercise. So you have to exercise and get your body to, especially yoga. Yoga is the best exercise we can do because it's a self-regulated amount of weight. Instead of pushing 200 kilos, your 70 kilos or 60 or 80 or whatever you are is the amount of weight that you can lift on your hands and your legs. And that is going to be very good for building your bones. And that will take care of the hair fall. There are also certain herbs that you can use to help augment that. Slip disc is about not moving properly and about not having nourishment in the cushions between the bones of your spine. And that really has to do with people spending too much time in chairs. That's a big reason why people have spine problems. You should move your spine regularly. And what I tell people to do is sit on the floor. Sit on the floor. Don't sleep on a mattress, cushion bed. Cushion beds where your spine is going like this, and adjusting, the bed adjusts to it. It's very, very bad for your spine. The closer you can sleep to the ground and to a natural surface of the ground, mud, wood, something natural, that's best. I don't own a bed. I haven't owned a bed since I was, since my parents put me on a bed. I have a futon, which is a cotton batting. In India, we call it a gadi, right? So it's a cotton mattress. I don't buy those modern polyester things because they don't breathe. And then you get very hot in the summer and they don't hold heat in the winter. So I find that really contributes to bad spinal health, is sleeping on bad mattresses, sitting on chairs. Go back to the basics. Sit on the floor when you eat, sit on the floor when you're hanging out, try to sit working on the floor with a little table above you. Spend as much time with your legs folded when you're eating so that the circulation doesn't go down into the legs like it does when you're sitting on a chair, and you'll find that your spine is much healthier. Okay, there's some new messages. Joint lubrication is related to Vata. So the lubrication is related to Kapha, but that Kapha is related, yes, to, so if the synovial fluid is a lubrication, then around it are the bones, which are moving, and the movement of the bones is Vata, but that synovial fluid or the bursa fluid, the liquid around the bone joints is the Kapha. So the Kapha is also there. I hope that was useful, Pablo. Manju asks, which oil would you recommend for head massage? It depends on the person. If you tend to be very hot-headed, then you need a cooling oil. But in the winter, which is coming now, if you use too cooling of an oil, you're going to catch a cold. So in the summer, I tell people to put coconut oil on their head if they're living in a hot area. So most of India is hot in the summer, except for up in the mountains. And so coconut oil is fine. The way to decide that is you take a container of coconut oil and you sit it on the counter, not in the sun, but on the counter. If it's liquid, that means it's warm enough for you to put it in your hair. If it's solid, it means it's too cold. So don't use coconut oil. So I find that in the very cold months, we use mustard oil in Bengal, but only when it's really cold, like in January. The rest of the time, sesame oil is a great oil, infused with amalaki, bringaraj, sometimes brahmi. You can find many good Ayurvedic hair oils. I tend to go to some of these companies that make them, such as Ayurveda Pharmacy, AVP, or Kotakal, or Nagarjuna in Kerala, because they really understand how to make hair oils properly. And then I use those. But sometimes, I'll use something that's very specified, like the Brahmi oil. Or, for example, if someone has lice or some kind of bugs, I use neem oil. So it really depends. There's another oil called Bala Ashwagandha. So Bala is a grounding oil. Ashwagandha is an energizer, so that you can use on your head as well. And there's a whole bunch of hair oils. And I think that's all the questions. I just see a bunch of things. Manju asked, can Gandusha be done with cow ghee in place of sesame oil? I mean, anyone can do anything. You put coconut oil and you do Gandusha, you will clog your channels. Fine, clog your channels, screw up your mouth, clog your channels. Ghee is not great for the mouth because you have a lot of bugs in your mouth, right? That's why you have bad taste in your mouth when you wake up. So those bacteria are naturally there, and ghee helps bacteria grow. Ghee helps the whole, life system grow, the whole biological system. So if you put ghee in your mouth, I don't know, it's not a terrible thing, but for Gandusha, there's only one oil that has been recommended, and that is sesame oil, because it cleans, it burrows through uh, the, the residue and the toxins that are in channels, and it cleans it out. So sesame oil is the only oil to use. If you want to try cow ghee and let me know how it works, you can, but I just I have so many arguments with these Americans who think, well, I can't stand the taste of sesame oil, so I would like to use olive oil, or I would like to use coconut oil. It's not what's prescribed, because it doesn't clean out the micro channels of the mouth. So I'll just say use sesame oil. There's a few more questions coming up. You guys are also late with your questions. Okay, well, so which dosha causes chronic kidney disease? So it depends on what kind of person it is, but usually it's clogged up, and that's the kapha. And it's usually if there's antibodies in there, like there is with many chronic kidney disease, or protein buildup like there is with diabetics, then that is kapha, but it's also pitta. Pitta is that transformation in enzymes. It's not happening properly. I've got a bunch of chronic kidney disease patients, one really active right now, and you can actually clean out the body. So you need to work with the gut, first clean out the gut, and then look at the person's lifestyle to get that in order, and then work with their foods so that they're eating foods that are whole foods. I never restrict people, because most people have trauma around dieting and various foods they can't eat. So I just tell them to add in sauteed vegetables, 3 meals a day, vegetables. And then slowly, I change their foods. And they themselves change, because if they're filled with vegetables, they're not going to reach for the Doritos or for the chocolate or for the Coca-Cola. And I shift them from coffee to tea, and then I shift them from tea to tisane, which is herbal tea. And I shift them from soda water to hot water. And so I find that I'm putting less artificial chemicals in their body. And with chronic kidney disease, there's a whole bunch of kidney herbs that are just amazing, that I've never seen modern medicine do this, but I've helped people bring back, creatinine levels that are 6, 7, 8 down and back into the 1.3, 1.2 range, just using these herbs. So there are 3 or 4 kidney herbs. One is for kidney stones, which is called Pashanbhed, which is breaking the stones. One is called Gokshura, but you have to know how to use Gokshura, because there's Gokshura and there's Gokshura Gugulu, and that will help clean out the kidneys and the bladder. And then there's Punarnava, which I mentioned before. And so learning these words is good, the herbs, but until you study them and know how to use them properly, if you just use them randomly, I won't say you'll harm yourself the way you would if you took a prescription drug that's a pharmaceutic, but you won't affect your body unless you work with someone who really knows how to do this, an Ayurvedic physician. So that's enough about chronic kidney disease. A couple more questions. What's the appropriate time to do Nasya? I think it's Nasya that you're trying to say, right? Not Nayasa. Is that right, Manju? Nayasa, Nasya. Yeah, Manju? So I'm going to pretend you said Nasya, because I'm not hearing from you, yes or no. So Nasya is cleansing the nose, and it depends on how much stuff you have in your nose. And it depends on what you consider Nasya. If you're talking about daily Nasya, then a drop of oil into your nose or a drop of ghee, depends on whether you're a Vata Pitta Kapha type and what kind of diseases you have. I tell older people, as a matter of practice, to put 1 drop of ghee, put your nose all the way back so your nose opening, your nostril opening is parallel to the ceiling. So all the way back, and put a drop of ghee and then snort it, and a drop of ghee and snort it. And it has to be cultured ghee, not this crappy stuff that we buy in the grocery stores. But you can buy cultured ghee. Now, put a drop of that in, and that's a very good preventive. And it cleans out the entire head and sinuses. But if you're going to cleanse, then you need to know which oil to use. People sometimes say, oh, I'll just use sesame oil, or I'll use Anu Thailam, or I'll use Shadbindu Thailam. There's about 7 different Nasya oils, And there's a whole process if you are going to do Nasya of using steam to open up your nasal passages before you put the oil in. And you have to know how to lean your head back, but you also have to know that after those drops are put in, it's going to coagulate a bunch of the stuff that's in your sinuses and to really collect that and take that down and out. So that's daily Nasya. You can learn how to do that. But yeah, that's how to do it. Time-wise, depends on your schedule. It depends on when you wake up. It depends on what you're doing in the day. It depends on the season. It depends on your age. Little babies, we never do Nasya. You don't start Nasya until they're about 13, 14 earliest, but usually they don't need it until they're 30 or 40 years old. People that have sinusitis do need it, but I usually tell them to do Jalneti, which is more of a yoga practice than it is an Ayurvedic practice. So as with most things in Ayurveda, there's a lot of parameters before you can decide. Now, the parameters are easy. I can do it in 2 minutes once I talk to someone, but you have to know those parameters, just like a doctor has to know the physiology and the conditions around the physiology. So a lot of nice comments. Thank you guys for your nice comments. Is there something to help improve joint lubrication, Pablo? Yes, there's a lot of things to improve joint lubrication. Depends on how much schmuck you have in your joints. You don't want to put oil on your joints if you have a lot of toxic residues there, because they'll just spread it all over the place and then you'll have more pain. And that's why people that put oil on their skin get more pain, right? So doctors say, oh, don't put oil on your skin, it's bad for you. Well, that's why. If the oil is something you can eat, then you can put it on your skin. If it's something you wouldn't put into your mouth, like mineral oil or jojoba oil or Johnson & Johnson's baby oil, then don't put it on your skin, because your skin eats, as we know from transdermal medications, your skin eats. We've also discovered the interstitium, which was another one of my slides. Modern medicine denied this presence of the interstitium under the skin, which is this highway from which you absorb stuff through your skin, and then the interstitium travels it around the entire body. It moves it. And that travel means that those chemicals move around the body. So whatever oil you use for your joints has to be appropriate for your body type. So for pain that is not a rheumatoid arthritis pain, where you don't have antibodies that are kind of collected and deposited in your joint, then you should not use any oil. You should use hot, boiled acid. It's called alepa, which is then cooled and then applied to your body. And that slowly pulls out those antibodies. But that alepa has to be prepared by a physician that knows you and knows what to put in the ingredients. Generally, it's acid from rice grains and from lemon juice, but it has to be made properly, and it doesn't have oil in it. So what it does is it pulls out those antibodies and it gets rid of them. It's pretty amazing to watch people have alepa treatment. And so you don't use oils for rheumatoid, but for osteoarthritis, where it's just breakdown, let's say you were a football player and you have osteoarthritis and you have no swelling and no redness in your joints, I love murivenna. Murivenna is a pain, oil. And usually when you use murivenna, you have to also take something by mouth, which is a scraping drug called guggulu. It's a resin. And so I find that using guduchi guggulu or yogaraj guggulu or kaishor, depends on your body type, that's a really great combination for osteoarthritis. I think that's all the questions, Aditi. Maybe you can guide me, but I'm seeing, I don't know why people put questions at the end rather than at the beginning, but I think that's all the good stuff I've got here. Nice questions. Great. So Dr. Bijlani, I'm about 4 minutes over time. Please, thank you for having me, and thank you.
Much gratitude for being with us. Now request Aditi to close the session. Thanks a lot.
Thank you, sir.
Yes, with this we come to an end of this, which we don't feel like ending. We have all the questions which can keep coming and you can keep answering. But at some time we have to end this. So thank you once again for giving us time in this module as well. We always learn a lot from you. And thank you everyone for attending the session. In the chat box, I have just posted 3 links which talk about the Dincharya Institute, the YouTube channel, and the blog section. So you can just Google these aspects and put it into your bookmarks. And thank you once again, everyone. We just end with a moment of silence. Thank you.